information literacy has been, I think it's just started. So health information literacy is the ability to make critical and balanced judgments about information. This definition is from CILIP, which is the Chartered Institute of Library and Information Professionals, which is the professional association for librarians in the UK. It's also been recognised by organisations such as UNESCO as a basic human right in the digital world, one that promotes social inclusion. So what is health information literacy? So it's very much related to information literacy, which is an umbrella concept. And the CILIP definition also defines what health information literacy is. So health information literacy helps people to make informed decisions about their health and their well-being. It helps people find creditable and reputable health information sources, and that supports them when they're looking for treatment. And it helps people be an active partner in their healthcare. So this involves patients being able to talk about their conditions with doctors and have an informed dialogue with healthcare professionals. So there are some different ideas about what health literacy means, partly because there are two different streams of health information literacy research, from the information science perspective, but also from the health perspective. And one of the most senior health literacy researchers in the UK, Donald Nutbeam, defined three different aspects to health literacy. He said there's functional health literacy, which includes the basic abilities to understand health information, so being able to read a medicine bottle, being able to make an appointment. And then there's interactive health literacy, which includes more sophisticated abilities to engage with a wider variety of health information and take part in discussions and decisions about care. And finally, we have critical health information literacy, which encompasses more advanced abilities to critically analyse health information and apply it across the life course. Much of the research and activity around measuring health literacy with questionnaires has focused on the functional aspect of health literacy. But I'm more interested in the socio-cultural perspective, which takes into account the complexity of the way in which people interact with information. And increasingly, there's research of this nature from both the health sciences and the information sciences perspective. Alison Hick's paper, which I reference here, is a great summary of the two schools of research. So my research is underpinned by this theoretical model, which was developed by the Australian researcher Anne-Marie Lloyd. And it's based on practice theory. So from a practice perspective, all practices are socially shaped and socially negotiated. This means that any definitions or models of information literacy need to reflect these communal and collaborative aspects of information creation and sharing. To effectively research health information literacy as a concept, it's important to include a focus on communities engaged in practices. Anne-Marie's definition highlights that information literacy is a contextual social practice, and it also includes a focus on embodied information, which is particularly relevant in the health setting. So I referenced just one of Anne-Marie's papers here, but she's written extensively about her theories of information literacy. So Anne-Marie says that there are three modalities of information, and these refer to the common spaces created by people in a particular information landscape, and these underpin what is thought about as knowledge in that area. So Lloyd's presented these in detail for various groups, particularly firefighters and ambulance workers. So the first one is the epistemic modality, which is characterised by explicit, factual, or often textual information that can be reproduced. The social modality is characterised as tacit information that is shared between people. It's unwritten and it refers to the norms of social convention. And then finally, we have the corporeal information modality, which is characterized by information accessed through the body. So becoming information literate in any landscape involves developing an understanding of these three modalities of information and how information is socially constructed in that landscape. So now I'm going to talk about the information literacy of self-tracking practices. So I'm going to present three different studies here, but first I'm going to talk a little bit about the literature underpinning these. So the quantified self started out as a really niche movement, but following the growth in connected smartphone usage and the increased use of wearable technologies, self-tracking is now a mainstream activity that many people routinely take part in. And we can see evidence of this from market research companies such as Mintel and records of the numbers of smartphone apps that are around health that are regularly downloaded and used. So many people use self-tracking apps and devices to monitor a whole range of bodily information such as diet, activity, steps, mood, menstruation, and sleep. So many authors in the literature have shared what they think of the positive aspects of self-tracking. So for example, that it allows people to feel a sense of control over their lives and feel empowered by the self-knowledge that tracking creates. And research has shown that self-trackers like the feeling that they know their bodies better and they can see measures of their health. And there's also evidence that self-tracking supports the management of non-communicable diseases, such as diabetes and heart disease. There's also evidence that self-tracking supports the management, so people report that self-tracking helps them make decisions about their health and have a relationship with self-tracking that enables them to stop when they feel they've achieved their health goals. However, self-tracking does have a negative side. So both users and health professionals have cast doubt on the accuracy of data tracked through apps and devices, and also the analysis that is performed for users. So this is a particular problem for sleep data, which sleep experts think is nonsense. And studies have shown that many doctors simply don't accept tracking data from their patients. There's also a danger that users will become obsessed with their tracking activity, which could be bad for their mental health, and some users do worry about this. Data privacy is a big concern, and there's lots of evidence that apps routinely share potentially sensitive data with third parties. And this is a particular issue for things like menstrual tracking in the United States and other countries where abortion is limited or illegal. And users often don't have very good understanding of these privacy concerns. Finally, there's a gender issue. So devices are designed for men's bodies and they enforce binary gender norms. So when you sign in, you have to choose either that you're a man or a woman, and there tends not to be any other option. So the first study that I'm going to talk about today is one focused on tracking of food with my colleagues Andrew Cox and Paula Goodale. So we held a focus group for 7 people and interviewed another 5 people, and they were all recruited through the University of Shefield mailing lists. And we particularly asked for participants who tracked their food or diet in some way. So most people were tracking their diet as a way to manage their health and their weight. And the MyFitnessPal app was the most common app used. And this is the market leader in the UK. And partly we think because it enables users to scan barcodes from food packages, which helps with the data entry. And data was analysed thematically, focusing on our research questions, using the lens of practice theory and the theory of information landscapes. So there was a lot of variety in tracking practice. Some people tracked every single mouthful, others were more relaxed. Some people logged their food all the time, and others just kind of once a day as a reflective moment. So tracking was very directive. It was a practice designed to achieve a particular goal, so weight loss or the management of a condition. One participant had type 2 diabetes, and another one wanted to monitor the nutrition of their vegetarian diet. So there's a type of practice that Rooksby describes as fetishized, where people become very interested in the technology and the devices, and there was evidence of this type of tracking practice. Some people tracked both food and exercise, but it became apparent that there was a very different flavour between these two types of tracking. So food tracking was much more difficult and fraught than exercise tracking, which happened very easily due to things like step counters. So as a reminder, the epistemic modality refers to kind of formal information in the landscape. And in the self-tracking landscape, this is the information that's recorded by the app or device that seem to be this kind of formal information. So in self-tracking, the tracker is the creator of the information, and they have to interpret often very detailed information provided by their app. And this quote here shows the detail of the information about the components of the diet provided by MyFitnessPal, which users become very adept at interpreting. So graphical representations of data were seen to be a really positive feature of the way that apps could summarize and present information about the self. And participants reported looking back at the data in the app from periods of successful weight loss as a way to understand their own behavior and identify food and exercise behaviors that could be applied again that had been successful. So the corporeal modality refers to information from the body. And we found that our participants focused on the quantity and weight of their food rather than on the taste. And it seemed as though tracking food took away some of the pleasure of eating it. And people wanted to focus on their goal and control their food intake through tracking. Tracking was used as a strategy to counter the perception of the strength of bodily desire for food or fears around the inability to control eating. So the few times the body was mentioned in our research data, it was often to assert the unreliability of the senses. So bodily sensations such as feeling bloated or hungry were mentioned as problems that might be controlled through food logging. And there just was a sense that people seemed to mistrust their own bodies. So in the social modality, participants were really reluctant to share their food logging practices, and they certainly didn't want to share their data. So it was seen to be, too personal, and they felt that sharing this practice and their data would make them seem boring or obsessed. They felt that sharing what they were doing when monitoring their diet would be unhealthy for young people in their lives and would de-pleasure food for other people. So it was a very private activity. So the social modality seemed to be around developing awareness of managing some of these subtleties and making sure that you're not sharing inappropriately. So this research, we identified 4 aspects to information literacy in this landscape. So those are understanding the importance of quality in data inputs, having the ability to interpret information from the app that's been tracked, and understanding the limitations of the technology. Third was an awareness of data privacy and how this data might be shared with third parties. And finally, the appropriate sharing of information that had been tracked. And these 4 aspects of information literacy have informed the following 2 studies. So the next study I'm going to talk about involved working with 3 partners to understand the self-tracking practices of different groups of people. So the first organisation that we worked with is called Parkrun, which is a non-profit organisation who host free weekly running events around the UK that take place in parks and other public spaces. And Parkrun focuses on inclusivity, and many people kind of start a fitness journey with Parkrun. Our next partner was the diabetes.co.uk charity, which has an online community. They support people with both types of diabetes, but we were particularly interested in those who had type 2 diabetes, which is a condition that can be controlled through diet and exercise. Type 2 diabetes is often diagnosed in later life, and it can present a range of other health complications. And finally, we partnered with the IBS Network charity, and IBS refers to the condition irritable bowel syndrome, which is a condition that's quite hard to define, and it's understood as a range of physiological factors rather than a single disease. It's a bowel disorder characterised by abdominal pain and disturbed defecation. And the exact cause of IBS is unknown, but stress and diet are known to be linked to the condition. It affects more women than men. So we distributed a short online questionnaire. It was advertised through various methods to the members of our 3 communities. And we had 143 responses from park runners, 140 from people with type 2 diabetes, and 45 from the IBS community. The questions focused on the use of apps and devices, motivations and reasons for engaging in self-tracking, and they were largely quantitative, apart from the final question, which invited respondents to tell us anything else that they'd like to share about their logging practice. And we had lots of really detailed responses to this particular question. Unsurprisingly, people from the parkrun community were really into tracking their running, and they used a lot more different devices, multiple devices, than people in the other 2 communities. Many of them tracked their running as a way to improve their performance, and this often took place over a long time. So it was an activity that they were really invested in. So with our diabetes respondents, they were less involved with technology, and some of them even used paper-based diaries to record their information. As you might expect, they tracked to help manage their condition, and they wanted to track specific aspects of their diet, most often sugar. They displayed a really good technical understanding of their conditions and the way that they could use diet to control that. And this control was quite an important aspect of their self-tracking practice. So although we might expect people with irritable bowel syndrome to track their food, they mostly didn't. Some of them had tracked their food in the past, but only 17% were current food logging app users. They seem to be around using tracking as a way to manage their weight. They were very critical of the challenges involved in using food logging apps, which were cumbersome and boring. They were also the community who were least likely to share their track data with their friends and family, whereas the park runners were really keen on it. So in terms of the 4 aspects of information literacy of self-tracking that I outlined earlier, I'm going to have a look at each of those now. So information literacy in this landscape is about making sure that data is accurately entered into the apps, and this is a particular challenge for food logging, which work quite well with pre-packaged food, as you can scan the barcode, but it's much less easy to use when you're cooking for yourself. So respondents wrote about how they had to develop their own strategies for circumventing perceived problems and inaccuracies in the apps. So one way to deal with these perceived issues was by becoming a data creator. So creating recipes and entering those into the app so that you'd have more accurate information. So comments also revealed that respondents modified and adjusted the data they perceived to be inaccurate, and also took some shortcuts when entering well-known food. A second aspect of information literacy in this landscape is about confidence in interpreting the data and the analysis provided by the app. So most respondents were really confident that they could understand the information provided to them by the app, and they had a really critical awareness of the differences between the data provided by the app developers and that provided by other users in the app. So in MyFitnessPal, you get recipes that have been provided by other people. They realised that some information provided by the apps was quite questionable. So, for example, some apps calculate the calorie offset from exercise, and this tended not to be particularly accurate. And the qualitative data revealed a really nuanced understanding of how tracked data fits with the overall information landscape of health and well-being, and how it could be used. So in terms of data privacy, which is the third aspect of information literacy, most people were really unconcerned about the potential reuse of their data by third parties, despite knowing that this was a possibility. In fact, the park runners in particular were really very unconcerned about long-term access to their. They were more concerned about long-term access to their data rather than the extent to which it was shared without their explicit knowledge. And in our previous study, participants described this as a trade-off. They felt that access to a free app was worth the potential sharing of their data. There was one exception, and that was with geolocation data. So the running app Strava often records the geolocation of where the run has taken place, and people did recognise that this was a privacy concern. So finally, there was a marked difference in the extent to which people shared their data and with who. So activity data was freely and widely shared, often on social media, particularly through the Strava app. People really liked sharing that and kind of making a community with their data. Whereas food and other tracked bodily data was much more rarely shared. Surprisingly, few participants, particularly from the diabetes.co.uk community, shared their data with a doctor, despite this potentially being very helpful. So just a few conclusions really from this study. So self-tracking is a very information-intensive activity. Involves users in entering data, interpreting information, and the outputs of the devices, and also managing access to the data. So effective and safe use of tracking depends on information literacy. The study showed that there's very different practices in these three different communities, and different apps and devices were used quite differently. Members had quite different motivations for and opinions of tracking. So food logging is overwhelmingly tiresome, fraught with issues of data quality. It seems to be an activity that people adopt and then discontinue more than tracking their exercise. So a key difference between diet and exercise tracking is that activity tracking happens automatically. It's not something that takes time or needs much input from the user. So as a result, information literacy in food tracking requires people to develop a more critical understanding of how detailed their tracking practice needs to be in order to provide them with meaningful analysis and achieve their goals. And there was definitely a sense that people really did lack awareness of the potential for their data to be sold and reused. And despite the potential benefits of sharing this kind of data with health professionals, that wasn't widely done. So the third study that I'm going to talk about is about self-tracking in LGBTQ plus students, which is the most recent study, and there's a paper forthcoming from that for the Journal of Information Literacy. So what do we mean when we say LGBTQ plus? So it refers to the lesbian, gay, bisexual community, with the plus standing for a wide range of other identities. And we know from research that the health of this community is generally poorer than the heterosexual straight population. And in the UK, it's been shown that LGBTQ plus people have higher incidence of mental health problems, and they are more depressed than the general population. This is a particular problem for trans people, as they have much lower life satisfaction. And there are also problems with the health service because many people from this community experience discrimination from health professionals. So this was a qualitative study. We did some interviews with LGBTQ plus students. We had a really great research assistant to help us do this work, who we recruited them through social media and mailing lists at UK universities, and we asked people to take part who were already identified as LGBTQ plus self-trackers. We did some thematic analysis on the data separately from each member of the research team, and then got together to talk about our analysis. So in this study, there were multiple motivations for people to take part in self-tracking activity. Some people wanted to monitor a particular aspect of their lives, but there was also a sense that people were tracking to develop a greater understanding of themselves. There was also evidence that self-tracking helped reduce anxiety, which would fit with the idea that LGBTQ plus people have a greater incidence of mental health problems. So tracking seemed to be a lot more fluid with this community than with our previous communities. So they changed their apps and devices quite a lot, and it tended to be something that they adopted for a particular reason at a particular time. Again, as with the other studies, people were really keen on the automatic tracking of exercise or any factor that could be automatically tracked. They wanted to track things, but they didn't want to spend a lot of effort doing it. There was some recognition that passive tracking accepts surveillance in some way because you're not sure who might be looking at the data. So there was some evidence that participants were concerned about their data privacy, but they certainly weren't worried, and they didn't think that their tracked data was particularly sensitive. They didn't think it really made any difference if somebody knew when their period happened or whatever. And again, there was this sense that there was a trade-off. So the convenience of the app and the free access to it outweighed any concerns that they had about privacy. There was some sort of activity where people would falsify information that they entered into the app to sort of protect themselves a little bit from any potential connection between the app data and their kind of real self. So in terms of data sharing, they generally didn't share their data. They were a bit concerned about being judged by people within their social network, just as a sort of general principle. And also they didn't want to be seen to be competitive. So this second quote here was from a participant who was kind of pushing back against this idea that you wanted to compete with your data. And this is also linked to the literature review from the literature around self-tracking of LGBTQ plus community and the kind of masculinized competitive worldview from tracking. There was a little bit of collaborative self-tracking and sharing of data within a sort of trusted group. And there were some really mixed feelings about the value of sharing data with health professionals. And this was particularly true for those going through medical transition who found it quite problematic and that they might cause them problems to share their data with a health professional. So there was concerns about the accuracy of the technology, the range of input options within certain apps and devices, and also the extent to which the outputs from the app and device were relevant. So this top quote here, you can see, and I've seen this happen as well with my own Fitbit, you move it around a bit, it counts some steps. So like, actually, how accurate is it? They also identified that they're very difficult to track home-cooked meals and that the outputs were not always useful. There was also some fear of obsessive tracking and the impact that that potentially might have on the mental health. We were interested in the extent to which self-tracking was connected with a sense of LGBTQ plus identity. So some of our participants didn't really connect it and others did. So this again was particularly true for those who were undergoing medical transition. So they wanted to track certain aspects of their bodies that might be changed through going through medical transition. So for example, changes in body fat percentage. But they were very concerned about the normative assumptions made by the apps about their gender and potential relationships that they might have, so particularly around menstruation. So this quote is saying from this particular participant that it was assuming that they were tracking their periods because they were in a heterosexual relationship and there was a risk of them becoming pregnant, but that in fact was couldn't have been further from the truth. So it was quite alienating and jarring. They also spoke about the fact that apps only have often 2 gender options and there was no diversity in the way that you could record your gender. And the apps didn't take account of different physiologies. And this very long quote, I think, really illustrates how unpleasant it was as a trans person to have these assumptions made about you. And we really got the sense that this can exacerbate already the negative implications of being in a minoritized group. So just in conclusion, in information literacy in this landscape, so in the corporeal modality, the self-tracking really enables this recording and codification of corporeal information. And information literacy is developed through understanding the body as a source of information. In the social modality, it was about making a nuanced decision about whether to share information in social networks. And it could be argued that there's a way to experience empowerment through this, but it wasn't particularly apparent for these participants, whereas other studies have really focused on the value of community of LGBTQ plus people, but our self-trackers weren't really using self-tracking for this purpose. So in the epistemic modality, again, there was a lot of doubt about the accuracy of the data and whether it was objectively factual, a lot of inconsistencies. So health information literacy revolves around understanding some of these problems. And one way that it would be good to support information literacy would be to have better advice from health agencies and doctors around the value of self-tracking information and what's good and valuable to collect. So experiencing empowerment through information literacy is linked to understanding privacy, surveillance, and the social limitations of tracking. So I was going to pause here for any questions about the self-tracking practices. If there was any questions from the room via text or in voice.
Gente, então agora nós vamos então abrir depois dessa conferência, né? Well, thank you, Pam. After this wonderful conference, I'm sure we all have lots of questions, perhaps, to discuss with you, because it was such an interesting conference. Vocês têm... vamos abrir, então, agora para perguntas, dúvidas, comentários. Edberto? Ah, desculpe. Well, we have a... Ela pode ver lá? You can see there is a question for you.
Yeah, so Fabio, in what ways can information literacy help app users develop a critical awareness of the functionality and benefits of the apps they use? So I think it's about reflecting on the information and trying to develop your own understanding of the information that you see from the app and the device. So I think it's about being critical of the information and not accepting it as face value. And by doing that, you're developing your information literacy.
Perguntas? Other questions? Pamela, during your presentation, I noticed that in the tracking devices and in some answers of the two research, a kind of an obsession about weight loss. In this sense, I don't know, but I would risk to say that the weight data are becoming a kind of sensitive personal data for some persons. And as you mentioned, the body is a source of information. And in this sense, my hypothesis is that such an obsession for losing weight can be interpreted that the sharing of weight information can lead for some presumptions and perhaps some prejudices. What do you think about this?
Yeah, it's a really interesting area, I think, because there are like face-to-face classes in the UK run by an organization called Weight Watchers, where the sharing of your weight and the measuring of yourself in front of the people in the class is seen to be a very motivating factor. But with the app data, people didn't really want to share it at all. And other people spoke about, rather than monitoring their weight using a scale, they would monitor their size using other measures, so like how tight their jeans felt and that kind of thing. I mean, obesity is a big health problem in the UK, and particularly since the pandemic, where people have been eating more and exercising less. And we have a lot of health messaging coming from our National Health Service, but also through the media to say that being overweight is really bad for you. But there still seems to be an element of shame. So people feel ashamed that they are overweight and they want to take steps about it. But it's quite difficult to do that in a very measured way. So I think it's a very difficult landscape for people to act in, and apps and devices to support either the reduction in calories consumed or the increase in the amount of exercise that people are able to do are seen to be perhaps a private way to support weight loss.
Okay, thank you. Perguntas? Comentários?
Okay, so there's a question here saying some problems are common to other research on information literacy, so information sharing practices and security. So do I consider these to be the main concerns of research in information literacy today? Yeah, well, I think this ties in with the idea that information literacy is something that's socially constructed. So ideally, when we share information, it could be for our benefit. I think the privacy issue is very concerning, particularly for health, because there is a big potential for this health data to be exploited or to be shared without the knowledge of the person. And in my research, I was looking already at some instances in the United States where the recent changes in abortion law have meant that lawyers have been looking at menstrual data collected by apps to try to prove that a woman has sought an abortion because she knew that she was pregnant. So the app data would prove that she knew that she was pregnant. So it is very concerning, and you could see a situation where health insurance companies would want to know or would want access to your data about your diet, for example, as a way to adjust the insurance premiums that you pay. So I think it is very concerning landscape. Whether it's the big challenge for information literacy research, I don't know, but I'm interested in it. Okay, shall I move on to the second part?
No.
Yeah, shall I move on?
Oh, nenhuma? Well, Pamela, I think that all of us are delighted with your conference, and you gave us lots of new ideas, new questions, and I think that this is what research is for. So we thank you so much from the bottom of our hearts for your lovely and your sound conference. And you can be sure that all the faculty of our information science graduate school, as well as our students, will be very interested in keeping in contact with you and perhaps welcoming you here in Marília. We'll be delighted someday to have your visits to our program. We thank you so much indeed.
Thank you. Thank you. It's been an absolute delight. I'm very happy to have shared my research with you.
Thank you.
Thank you.
Thank you.